My name is Bethany. I'm a librarian with Plano Public Library. I want to thank you for joining us today for Medicare 101. We're going to wait just another minute or so, see if we have any other people joining us. We may get some latecomers as well. Please note that if you have any questions during this program, you can type them into the chat. I'll be monitoring it and I can draw Mary's attention, our presenter, to your questions. This program is being recorded and will be made available on the Plano Public Library YouTube page for later viewing. And you will receive a follow-up email following the program with a link to the presentation slides, or you can contact our presenter directly. I'm going to go ahead and put her email in the chat. So right now I'd like to welcome Mary Jane Frank, Benefits Counselor for the Area Agency on Aging of North Central Texas.
Okay, thanks, Bethany. All right, I'm going to share my screen. All right, hopefully everybody can see my PowerPoint. Okay, so I am with the Area Agency on Aging, and there are 28 area agencies on aging in the state of Texas. So we are funded by a federal program, the Older Americans Act, and then that money is funneled down through the federal government to the state agencies through Health and Human Services, and then that money is divided out between the 28 area agencies on aging in the state of Texas. So most of my funding comes through Medicare and Medicaid. So we are a nonprofit. So today we're going to talk about just some Medicare basics. It's a lot of information. And again, if you need a copy of the PowerPoint, you can, I think Bethany can send you a link to it. And then also I can email you the presentation. So let's go on and get started. Okay, so what is Medicare? So Medicare is health insurance for people that are 65 and older, or you could be under 65 and have Medicare. So as long as you're determined disabled through Social Security, then after you're on disability for 2 years, you become eligible for Medicare, unless you're diagnosed with ALS, and then you receive Medicare without a waiting period, or at any age, if you're diagnosed with end-stage renal disease, then there's a short waiting period before your Medicare. So to get Medicare, you must be a U.S. citizen or lawfully present in the U.S., and you must be in the United States for 5 continuous years. So how do you handle enrolling into Medicare? And just a minute, let me try to, I've got this bar at the top and I'm trying to do away with it. Okay, not really for sure how to do that, but can you all see the title of the slide?
What agencies are responsible for Medicare?
Okay, yes.
Yeah,
so
it looks great.
There's a bar at the top that I can choose commands, and I'm just trying to minimize that bar. Or
I don't think we see it.
Okay, all right. It just blocks the name of the slide from me. I can't see it. Okay, so if you are going to enroll in Medicare, it depends on how you or who you have your work history with. So if you worked a job and you paid into Social Security, then you would contact Social Security to enroll in Medicare. If you worked for the railroad, then you would contact the Railroad Retiree Board. And if you worked for the federal government, then you would contact the Office of Personnel Management. So those are the ones that decide if you have sufficient work record and you've paid into Medicare to be able to get your Medicare benefits. And then after you enroll in Medicare, then CMS handles the rest. So CMS being Centers for Medicare and Medicaid Services. So these are when we talk about original Medicare, we're just talking about Part A and Part B. Part A is your hospitalization. Part B is your doctor's visits, outpatient services, MRIs, x-rays. Part D is optional, but you have to have a Part D to cover your prescriptions that you get filled at the pharmacy. So you have a couple of choices when you become eligible for Medicare. You can either on the left stay with the original Medicare, or on the right go with a Medicare Advantage plan. So if you stay with the original Medicare, you might want to consider getting a Medigap or a supplement to fill in the gap or supplement what Medicare does not pay. And we're going to talk about that a little bit later. So original Medicare, again, consists of Part A and Part B. Part A is your hospitalization. Part B is your doctor's visits, outpatient services, MRIs, x-rays, lab work. And then you would need to enroll in a Part D drug plan to cover your prescriptions that you get filled at the pharmacy. And then also you might consider getting a supplemental coverage called a Medigap to fill in the gap or supplement what your Medicare does not cover. And we're going to talk about that, what Medicare, your copays and coinsurances and all of that. Or you can go with a Medicare Advantage plan. This is your other choice. The Medicare Advantage plans have the health and the drug plan embedded together in one package. So they're kind of an all-in-one. You don't have to enroll in a separate drug plan. They might have lower out-of-pocket costs than original Medicare, and they might offer some extra benefits like vision, dental, and hearing. So if you're already receiving Social Security benefits or railroad retirement benefits when you age into Medicare, which is age 65, you're automatically going to get a Medicare card. So if you're collecting disability, or if you're collecting widows' pensions or early retirement, then you're already in the system. And so you automatically will get a Medicare card when you're eligible for Medicare. Your initial enrollment period or your initial enrollment package is mailed out to you 3 months before you turn 65 or your 25th month of disability. So remember, I said when you're on disability for 2 years and you're term and disabled through Social Security, then you receive Medicare after 2 years of disability. So on the 25th month of disability benefits, and this initial enrollment period package includes your Medicare card. So this is what a Medicare card looks like. It has your name, it has your Medicare number, and it has when your hospital Part A and Part B became effective, the dates for that. A and B might vary. They're not always the same date. So there might be some reasons that you don't want to sign up for the medical Part B. And so if you automatically receive your Medicare card and they've signed you up for Part B and you don't want Part B, you need to look on the card. It explains how you return it, how you decline Part B, and then they will send you a new card with just Part A only. So your Medicare card really needs to reflect what coverage you want to have, because if you've worked your 40 quarters and you paid your FICA taxes, there's no premium for Part A, but there is a premium for Part B, and we're going to talk about that. So if you aren't automatically enrolled in Part A and Part B, so you're not getting Social Security benefits or railroad retirement benefits, we talked about that, you have to enroll yourself. So you would enroll through Social Security or the Railroad Retirement Board or the Office of Personnel Management, depending on who your work history is with. And down at the bottom, there's a note. It says the age of full Social Security retirement benefits is going up for people born in 1938 or later. Those born in 1960 and later will get full retirement benefits at age 67. So kind of what that's saying is your Medicare age and your full retirement age are not the same. So if you have a work history, you've paid your FICA taxes, then you age into Medicare at age 65, but 65 might not be your full retirement age. So if you were to draw Social Security retirements before your full retirement age, you might get a reduced amount. So if you don't already have Medicare and you want to enroll into Medicare, there are certain enrollment periods when you can do that. Your initial enrollment period, that's when you first become eligible for Medicare. The general enrollment period, if you didn't enroll during your initial enrollment period, and that is January through March of each year. And then there might be certain circumstances where you would have a special enrollment period. If you already have Medicare and you want to make changes to your Medicare, then these are the times that you can do that. During your yearly open enrollment period, which is what we're getting ready to come on just here in the middle of October. It's October the 15th through December the 7th, where you look at what you have and you decide if that's going to be the best plan for you for the next year. And whatever changes you make become effective January 1. Then there's a Medicare Advantage open enrollment period. There's a 5-star enrollment period. And then in certain circumstances, there's a special enrollment period. And again, we're going to talk about these. So your initial enrollment period covers a 7-month period, 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. So you want to make sure that you enroll in Medicare during this 7-month period. If you don't already have, maybe you might be working and you have group employer insurance, either yourself or through your spouse, through active employment. That would be one reason you might not enroll into Medicare and would not have to pay a late enrollment penalty for not enrolling in Medicare when you became eligible. This is the general enrollment period for Medicare. So if you didn't enroll in Medicare when you were eligible and you didn't have credible coverage, meaning employer coverage, then there is a 3-month period during each year when you can enroll in A and B. And that is January 1 through the end of March. If you enroll during this time, you might have late enrollment penalties and your coverage does not begin until July 1. Then there's an open enrollment period for the Medicare Advantage plans, and that also is January 1st through March 31st. To be able to participate in this Medicare open enrollment period, you must be enrolled in a Medicare Advantage plan as of January 1. So during this 3-month period, you can change from one Medicare Advantage plan to another. You can change from a Medicare Advantage plan with drug coverage to a Medicare Advantage plan without drug coverage, or vice versa. Or you can drop your Medicare Advantage plan and go back to original Medicare and pick up a drug plan. So if you have Medicare during the open enrollment period, which is October the 15th through December the 7th, that is when my busiest time of year is, then you can enroll in a different plan. So you want to always look at the plan you have and make sure it's going to be the best plan for you for next year, whether it be a prescription drug plan or a Medicare Advantage plan, because they change those plans. They change the drugs formulary. They might drop drugs. They might add drugs. They might change their premium, their deductibles. And so you want to make sure that you're still in the best plan for you for the following year. And you can make changes during October the 15th to December the 7th, and they become effective January 1. If you are eligible for Medicare, let's say you turn 65, but you're currently working and you have group health insurance, and that insurance is credible coverage, you can delay enrolling into Medicare. Then when you retire, then you have a special enrollment period of 8 months to sign up for Medicare Part A and B. But there's a caveat to that. You only have 63 days to sign up for drug coverage. So you just want to make sure. Why they didn't make those coincide with each other, I don't know. But you do have 8 months to sign up for A and B. Now, a lot of people, if you're working, you have credible coverage, your insurance or your work policy is you're fine, You don't have to go with Medicare all the way because a lot of companies have different policies. You always want to check with your HR or benefits person to say, hey, I'm becoming eligible for Medicare. Can I stay on my employer coverage? And is it credible coverage? Then once you retire, before you retire, you might want to sign up for Part A. It's premium free. That is an option. And then just delay signing up for Part B. Then when you retire, you have 8 months to sign up for Medicare Part B, as in boy. And you'll have to get some paperwork filled out by your employer. It's called a CMSL 564. And that will, your employer will document that you've had credible coverage all this time. So you will not be charged a penalty for not signing up for Medicare when you were first eligible for it. The 5-star enrollment period allows you to enroll in a 5-star plan once during the year. So these plans are rated on Medicare's website or Medicare's Plan Finder. They have a Plan Finder tool. And so if you find a plan that is a 5-star plan, you have one special enrollment period to switch to a 5-star plan during the year. So whether that is a Medicare Advantage plan or a drug plan. And then there's other special enrollment periods. If you move out of your plan's service area and it's not offered in the new area where you live, then you have a special enrollment period. If you have Medicare and Medicaid, there is a program also called Extra Help. And if you're on Extra Help with your prescription drug coverage, then you can change your plan once a quarter. If your Medicare plan leaves the program or reduces its service area, that would be a reason to give you a special enrollment period. If you enter, live at, or leave a long-term care facility, like a nursing home, that would give you a special enrollment period. If you lose your Extra Help status, which is a program to help with your prescription drug coverage, it is a government program. We're going to talk about that later. Then if you lose that status, then you are allowed a special enrollment period. If you've received a notice that you have Medicare entitlement and they made it retroactive, that would give you a special enrollment period. If you leave or lose your employer coverage, that would give you a special enrollment period. And then there's other circumstances. Now let's kind of talk about Part A and Part B, the coverages. So Part A is your hospitalization. It covers you when you're in the hospital, and it also covers you in inpatient skilled nursing facility care. So that's rehab. So let's say you broke your hip, you go into the hospital, they replace your hip, and then now you go to rehab to learn to walk on your new hip. So you have to spend a 3-midnight stay in the hospital for Medicare to cover rehab for you. So your hospital insurance covers your services, your blood, your home health care, if needed, and hospice care. What isn't covered on Part A is private duty nursing, a private room unless it's medically necessary. So let's say you have to be quarantined from other people, that's medically necessary. So it would cover a private room in that situation. It doesn't cover the television or phone in your room if there's a separate charge for these items. Most of the time there isn't, but if there is, Medicare will not cover that. And they will not cover personal items like the razors or the slipper socks if they charge you for it. So most people get Part A premium free. If you worked your 40 quarters or your 10 years, you paid your FICA taxes, there's no premium for Part A. But if you don't have a sufficient work history, you might have to pay for your premium for Part A. And if you don't sign up when you're first eligible for Part A and you don't have employer coverage or credible coverage based on active employer work history, or you're not actively employed, you might have to pay a penalty for not having Part A when you were eligible for it. That penalty is 10% of the monthly premium, and you'll pay that higher premium for twice the number of years you could have had Part A and you didn't sign up. So these are what your costs are for 2021 for your Part A. Unfortunately, we don't have the 2022 figures, Medicare cost figures yet. They won't be out till probably the end of October or the 1st of November. But if you are admitted to the hospital and you have original Medicare and nothing else, your deductible is $1,484, and that will cover you for the first 60 days you're in the hospital. And that is per benefit period. And we're going to talk about what benefit periods are in just a minute. Then if you're in the hospital over 60 days, you see you've got some pretty hefty copays. If you go into the skilled nursing facility, so this is rehab. In rehab, if you have original Medicare and nothing else, it's $0 for the first 20 days and $185.50 for days 21 through 100. If you get your home health care services through Part A, there's zero cost for your home health services. If they do prescribe some durable medical equipment, there might be a 20% copay for that. Hospice care, there's no charge for that. If you have original Medicare and nothing else, there might be up to a $5 charge for your medications to manage pain and symptoms. And you might have to pay a 5% for inpatient respite care. And then there's no charge for the blood if they get the blood bank at no charge. So the benefit period. So remember that $1,484 per benefit period. So that the benefit period really is measured from when you're discharged from the hospital and maybe readmitted. So let's say you go to the hospital, you go to rehab, and then you're discharged for 60 days. And then day 61, you go back in the hospital. You're in a new benefit period and you would have to pay that $1,484 again. But let's say you go to the hospital, maybe you go to rehab, you're out of the rehab for 20 days, and then you're readmitted to the hospital. Well, that's not a 60-day lag in between discharge and readmission. So you would still be in the same benefit period and you would not have to pay that deductible again. So there's no limit to the number of benefit periods you can have. It's not just per calendar year. It's based on when you were discharged from the hospital and readmitted. So again, Part A is premium free for most people. If you're working and you have active employer coverage and your benefits administrator says that's fine, you can stay on our insurance, then you might want to consider signing up for Part A, unless, there's one caveat to that, you are contributing to a health savings account. If you are contributing to a health savings account, then you do not want to sign up for Part A because there is an IRS tax penalty if you contribute to a health savings account and have Medicare. Now, you can have money in a health savings account, not contribute to it, and use that money in the health savings account. And I don't think there's a penalty for that. But if you're contributing to the health savings account while you have Medicare, that's where you accrue the penalty. So your Part B is your doctor's visits, outpatient services, MRIs, x-rays, diabetic testing equipment and supplies. It covers a lot of the preventive services, home health care also, outpatient services. And there is a standard premium for Part B. It's $148.50. You might have to pay a higher amount if you're in a higher income bracket. There are some people who get Social Security benefits that are paying a little bit less than this, but the standard amount is $148.50. And again, these are numbers or dollar amounts for 2021. We don't have the figures yet for 2022. So if you're in a higher bracket, an income bracket, and it goes by your 2-year prior tax return. So 2021 is based on your 2019 tax return. So as an individual, there on the left, as an individual, if you make more than $88,000 but less than $111,000, you're going to pay a little bit more for your Part B premium. You're going to pay $207.90. Or as a couple, if you bring in more than $176,000, up to $222,000, then you would pay $207.90 for your Part B premium. And that would be for both of you. You'd each pay $207.90 if you're both on Medicare. And then it kind of goes up from there. So your deductible for your Medicare Part B is $203. That's just an annual deductible, not like the hospital deductible per benefit period. This is an annual deductible. And once you satisfy that out of your pocket, then it's 80-20. Medicare pays 80% and you pay 20%. So if you're not getting employer coverage, insurance coverage from active employment, and you don't sign up for Medicare Part B, it might mean that you would have to pay a penalty for not signing up for Part B when you were eligible. And you would have to wait for that general enrollment period, which is January through March 31st, and then your coverage would not start until July 1st. So you just want to make sure that you check that the insurance that you have is credible coverage and that your employer will allow you to stay on their employer coverage, even if you're eligible for Medicare. And in that respect, then you won't have to pay the penalty, and you'll just have to document that you've had credible coverage by that form we talked about, a CMSL 564. You will hand it to your employer will fill it out, and you will submit that to Social Security to show that you did have credible coverage, so they will not charge you a penalty. Then when you retire, you have 8 months to sign up for Medicare Part B, as in boy. So there is a monthly premium for Part B. If you're collecting Social Security benefits or railroad retirement benefits, they will automatically deduct that $148.50 from your benefits. If you're not collecting benefits yet, because maybe you want to wait till your full retirement age, then you'll have to pay the $148.50. They'll either bill you monthly, or there's some other ways that you can arrange to have it where you just pay it monthly, like deduct it from your bank account. I think there's a couple of other ways, but you will have to pay that directly to Medicare. So if you want to have a Medicare supplement or a Medigap policy or a Medicare Advantage plan, or if you're eligible for TRICARE for Life or any of the like CHAMP VA, or your employer has less than 20 employees, you have to have Medicare Part A and B. So that last little bullet point, if you work for a company, you're aging into Medicare, turning 65, and your employer has less than 20 employees, then you don't have a choice. You do have to enroll into Medicare, Part A and Part B. Down there at the bottom, the note that their Veteran Affairs benefits are separate from Medicare. They usually don't coordinate benefits. Your VA benefits are separate from your Medicare benefits. So if you're getting your coverage, so maybe you're not eligible, maybe you're not retired military, but you served in the military, so you're able to get benefits, health benefits through one of the VA hospitals. If you choose not to sign up for Medicare Part B, as in boy, during your initial enrollment period, and you're not currently working, then you will be subject to that penalty if later down the road you decide that you want to enroll in Medicare Part B. You will have to pay that penalty. These are some items and services that are not covered by Part A and Part B: dental care, eye examinations relating to prescribing glasses. So they will pay for an eye exam once a year, but they won't pay for the refractory part. So is one better or two better? Is two better or three better when they do that? Medicare will not pay for that. They won't pay for dentures, cosmetic surgery, routine physical exams, massage therapy, hearing aids, long-term care, or some of those concierge care or boutique doctors. So the Medigap policies, let's talk about them. That is your supplement policies that you buy to supplement original Medicare or to fill in the gap. They're called Medigaps, to fill in the gap that your Part A and Part B with original Medicare do not cover. They're sold by